Hello and welcome to Virginia Medical Updates Show. I'm your host Eileen Blafkin, and today's program is sponsored by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine in their practice to complement their expertise in medical care. Their areas of specialties are in weight management, preventative medicine, and holistic health. Our guest today is Ron Lapitan. Ron, welcome to our program.
Thanks for having me.
Wonderful to have you. Ron Lapitan graduated from George Mason University with a bachelor's in interpersonal communication, which studies how people form relationships. He's extensive experience working with youth empowerment programs and currently works as community outreach coordinator for the Center for Health and Human Rights. He's responsible for launching its Health and Rights School program in middle and high schools throughout Virginia, D.C. and the Maryland area. Ron, it's wonderful to have you.
Thanks for having me.
Thank you for joining us. First, can you tell us about what Center for Health and Human Rights is?
Absolutely. So Center for Health and Human Rights is a Northern Virginia medical clinic that provides free services to community members without insurance. This includes homeless individuals, refugees, and immigrants without insurance. And the reason why we have this service is because our physicians believe that when it comes to being healthy, having access to treatment should be based on what you need rather than what you can afford. So according to our physicians, health is a right, hence our name, Center for Health and Human Rights. And we also strive to promote a dialogue of public health in our community, which is really where our school program is coming out of.
That's how it came to be.
Absolutely.
What is the Health as Rights program that you guys started?
For this program, we go into schools and we ask students, if you could change something about your community, that if this changed, it would cause people to live healthier lives, what would you change? So what we're doing is we're engaging teams of students to think about what are the pressing public health problems of our community, and then we empower them to create innovative solutions and service initiatives to address those problems. And once our student leaders have their ideas, our center provides them support and resources to translate those project ideas into reality. So our support comes in the form of a budget. If they need volunteers for their public health projects, they can come from our office.
I see.
And our student leaders also go through a curriculum that teaches them about public health, human rights, and the skills necessary for creating social change. So this program is really guided by our belief that everyone can be an agent of public health, not just doctors and physicians.
That's really incredible. Is this program only for middle school and high schools just in the Virginia area?
It is not. We're targeting schools throughout Virginia, D.C., and Maryland.
So the 3 states.
Absolutely.
And Ron, tell us a little bit about what these groups look like. How do they, form? How do they come into being?
Absolutely. So like I said, they come into being when we have a contact at the school, and then we have that contact help us bring together teams of students. And then when those students agree to be part of our program, they come up with public health projects they want to solve, and they create projects for that. So one of our teams is in Fairfax High School. And what our students there do is they work 4 times a month with kids in the foster system to empower them to finish high school.
Wow.
So what they learned from research that they did is that only about 30% of foster kids finish high school because of an often disempowering social environment.
Sure.
So when they age out of the system, a lot of them become homeless, incarcerated. They have a high risk for teen pregnancy and human trafficking.
Right.
So our students work 4 times a month with foster students to help them get through school as a very strategic way of fighting all those health problems at once. Another example is we have a team in Mount Vernon High School, and their projects center around creating more resources for homeless students. And they're also raising awareness of the school's psychiatrists so that students with depression or stress, they know this person is here, you can talk to her about your problems to help with your coping skills. As a final example, we have a group in Marshall High School, and their projects center around improving the school for immigrant and refugee students. So one thing they noticed is that immigrant and refugee students often don't feel accepted at the school. So they're working on creating spaces of conversation for students and faculty to talk about, okay, how as members of this community do we make the immigrant and refugee students feel like they're part of this community too? Another thing they noticed is that the female and immigrant and refugee students often can't afford female hygiene protection.
Okay.
And the school doesn't have a working system to provide access to that. So our team is going to design a system to provide access to female hygiene protection to students and propose it to the school to implement. So far, we've started clubs like that in 8 schools.
Wow.
And each of them has a project like that that they're working on.
That is incredible. That is really incredible. What sort of curriculum do your student leaders go through?
Right. So the curriculum that our student leaders go through at the same time as they're creating and carrying out these service projects is really centered on teaching them how to have conversations about public health and human rights. So for example, the first unit of this curriculum, they have to read the Universal Declaration of Human Rights. So they learn that according to the UN, every individual should have the right to food, clean water, medical services, and all the basic needs to develop as a full human being.
Right.
And then they have to discuss what changes need to be made in society in order to create this kind of culture. So our hope is that the values that our student leaders foster going through this curriculum will stay with them throughout their whole life so that they can work to make these changes in society to create a culture of health and human rights. Just like our physicians at Center for Health and Human Rights who use their skills and knowledge to create a free clinic.
Right.
So just imagine nurturing a whole generation of people with that ethic of service, and you've got the vision of our program.
That's incredible. That's really incredible. How can this program fit into a pre-existing school curriculum?
Right. So there are several programs schools do already that fit well with our program. One of them is the International Baccalaureate Diploma Program,
Right.
where students have to create and lead their own service learning initiative. So a student could fulfill their IB requirement by launching a Health is Right club at their school.
Wow.
And our program also fits really well with ESL courses. So even though our program is for all students, whatever their background, the curriculum we designed was inspired by effective models from throughout the country for teaching human rights to ESL students without at all lessening the material.
Right.
So one example is our Annandale High School team this year. It consisted of an ESL government class.
Wow.
Yeah, and for their project, they created a video, an educational video about the health impacts of smoking. And then they sent this video to an elementary school for the children there to watch. And they had a research team for this, they had a script writing team, and an acting team.
My goodness.
So it fit perfectly into everything they were learning for their class about, investigating social problems and then making public service announcements. And at the same time, it required them to develop their language skills. So it fit perfectly with everything the teachers were already doing.
That's really amazing. What sort of benefits have you seen for the students that are involved in these programs, Ron?
Right. So in addition to believing that our students can transform local quality of life with their projects, we think our program has a strong potential to enable our student leaders to live healthier lives themselves. So a lot of the design of our program was based off of research that the Fairfax County does in the public schools each year. It's called the Youth Survey. And the Youth Survey identified 6 social conditions that if a young person has a combination of 3 of these in their life, it greatly reduces the risk of behaviors like early sex, drug and alcohol abuse, carrying a weapon, and participating in gangs. And these 6 criteria are having community adults that they can talk to, having teachers recognize good work, having a high level of personal integrity, participating in extracurricular activities, performing community service, and having parents available for help. So if you have a combination of at least 3 of these, the risk for all of those behaviors I just mentioned goes down significantly. And our program is strongly designed to cultivate 5 of these. The only one we're missing is having parents available for help.
But that's absolutely incredible.
Absolutely.
What would your ultimate goal be with this program?
Right. This program was developed by our doctors from Center for Health and Human Rights. And the vital work of a doctor is that they treat an illness or an injury once it becomes a visible problem. But there are a lot of things that doctors can't do to help people live healthier lives because the problems are a part of values and a part of culture.
Sure.
But if you can change that culture into one that supports people to be healthy as if it's a human right, then that's a very transformative contribution. And every person who's a member of a community has the power to make that contribution. And the ultimate goal of our project is just to show the youth of our community that they have this power.
How to really empower them.
Absolutely.
What could the viewers do to support Health as Rights school program?
Right. So our biggest need is to connect with more schools, to share what our program is, and to explore how we can offer it to student leaders who are passionate about change. So for any viewers who have connections to teachers or administrators here in Virginia or DC or Maryland, you can contact me personally, and then I'll work with you to start a Health is Right club at that school. If you're a student listening who is passionate about public health or social change, or is looking for a service initiative to lead, you can also contact me personally, and I will work with you to start the Health is Right Club for your school.
That's wonderful. What could viewers do to support other works at the Center for Health and Human Rights?
Absolutely. So if you're a provider and you would be interested in offering your specialized skills to marginalized communities, you can contact us and become a part of our network that offers our services at free or at a discount for these communities. And also, everyone can join and share our social media to spread this conversation about health as a human right.
That's fabulous. How can community members in need access CHHR services?
We see our free patients on Tuesdays and Thursdays at our permanent location, which is in Fairfax. All you have to do is call our number. We'll do an income screening, which takes only about a week, just to make sure our patient is someone who really needs our services.
Sure.
And then that's it, we schedule you.
That's wonderful. How incredible to have this in our community. Ron, thank you so much for joining us today and sharing this incredible program that you're a part of.
Thanks for having me.
Our show was sponsored by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine in their practice to complement their expertise in medical care. Their areas of specialties are in weight management, preventative medicine, and holistic health. Please remember to follow us on YouTube, Facebook, and Twitter. I'm your host, Eileen Blafkin, and we look forward to seeing you next time.